Welcome back. The World Health Organization has raised concerns over growing COVID-19 cases and the slow vaccine rollout in Africa. The continent is facing a surge in infections. Let's discuss this with Thierno Balde, who is with the World Health Organization's Africa Regional Office. Thank you so much for your time, Mr. Balde. A lot of countries are now experiencing the third wave of COVID-19. Is the continent winning the battle against the pandemic?
Thank you for the opportunity. Yes, we are really monitoring the situation in the entire continent, and definitely we are seeing an increase in number of COVID-19 cases and deaths in the continent. And it's important to note that we have some few countries currently which are driving with this trend, which are countries like South Africa, Uganda, Zambia, some of the countries which are on the Southern African sub-region. These are the ones really which are accounting for almost 75% of the total number of cases in the African continent. However, this being said, it's also important to note that other countries in Central Africa has been really noticing a quite increasing number of COVID-19 cases. So this is the current situation, and there are many actions which are currently ongoing. But obviously, with the related limited number of the vaccine, the response against the COVID-19 is quite, not going at the pace that we would like to go. So which have been conducted, but definitely having additional resources, notably with more vaccine, will have helped for supporting the pace, the accelerating the response of this pandemic in our region.
Yeah, and I guess it doesn't help that we're still struggling with vaccines. We simply don't have enough. Do you know what percentage has been vaccinated so far on the continent?
It's a very low number. The figures do change quite very regularly, but we are talking about 1% or 2% of the people who have been vaccinated in our continent. And the WHO has a target of really vaccinating at least by September 10,000 of all of the targeted population in our continent, and also 30% by December. So we are really doing our best for supporting that. The number of the vaccine, the quantity of the vaccine are quite limited, but there are also, it's important to note it, that there are other response measures which need to be undertaken for addressing this situation, which are around, the sensibilization of the people for the adoption of more of these public health and social measures, which are easy after 1.5 years of the pandemic. But we really need to have this collective effort at all levels, and again, for addressing this current situation.
Yeah, what happened with the COVAX program? Because that's where we were supposed to benefit mostly when it comes to vaccines.
Yeah, the COVAX system is a kind of system with the donation of some of the countries and also pharmaceutical companies. So there have been some promises, but for the time being, some of them has not been materialized yet. There are different efforts for advocacy for getting more of this vaccine from the COVAX system. For the time being, almost 23 million of doses of vaccine has been received in Africa, and almost 75% of these 23 million have been already administrated. It's quite very few, but again, there are a lot of other efforts which are currently ongoing for getting more vaccine. And obviously, we wanted also all of these promises which has been made by some of these wealthier countries, for providing more vaccine to our region to be materialized by facts. At the meantime, also there are other efforts which has been conducted by the African Union, for really procuring and purchasing more vaccine through the ABAT initiative. So we do hope that with the conjugation of all of these different efforts, probably we try to get more of the vaccine in our continent. Yeah. But at the meantime, people are currently sick, people are dying, so we really need to continue the fight and the response.
Yeah. What are the consequences of this slow pace of vaccines, especially for Africans? Because when you look at a lot of countries now, they're restricting travelers who have not been vaccinated. And because we've only vaccinated such a small percentage on the continent, it's mostly Africans that are going to be facing these restrictions when it comes to travel.
Yeah, there are really challenges ahead, which we are foreseeing. I mean, which we are discussing and which we are trying really to negotiate. I mean, with different countries, and there are efforts which are made. I mean, at all levels. I mean, not for both the WHO, but also of the other partners, and also by the African countries per se. You know, for really, addressing those challenges. But yes, I mean, for the time being, those are challenges that we are really foreseeing, and we do hope that there have been some of this decision which has been made. I mean, for defining the vaccine which are currently, authorized. I mean, for people authorized to travel to be lifted. The WHO, we go through really a very rigorous process. I mean, for the approval of this vaccine, and for the time being, there are 8 vaccines which has been, which went through this process, and definitely we do hope that different countries will just adopt this different vaccine which has been approved by WHO. As WHO is a member state organization, I mean, that's our mandate, and we do use all of the most evidence-based information for doing this assessment and then coming to this conclusion.
All right. Dr. Thierno Balde, thank you so much for your time. Team leader for World Health Organization Regional Office for Africa.